Okay. Today, our subject is acid-base regulation. Acid-base regulation, why is a few words in the beginning, maybe. Especially in patients with intensive care unit. In intensive care unit patients, you need to follow the pH of the blood of the patients. For daily life, it's not that important because there are many regulatory mechanisms working to adjust the blood pH, blood hydrogen concentration. Blood hydrogen concentration is very, very low. That's why it is present as a minus logarithm. So it is much easier to talk about it. It is 7.4. Okay, 7.4 is the arterial pH value kept constant all the time. If there is a pain you take care of, you have to check taking arterial blood. It's not easy to take arterial blood. It is easy to take capillary blood from the fingerprint finger tip, or it's easy to get venous blood from the peripheral veins, but it's not that easy to get arterial blood. Somehow you have to do it. Femoral artery is generally used to take arterial blood. Arterial radialis you can use to take arterial blood. Simultaneously, today technology is developed from the laboratory, arterial oxygen, carbon dioxide, partial pressures, oxygen saturation, and also pH will come evaluated. Okay, it's not that difficult. So you will see the results, and then you will evaluate the patient's acid-base balance. If there is a problem with respiration, for example, breathing, this means that carbon dioxide can stay in the body and it will form carbonic acid by combining with, reacting with water. Okay, and then carbonic acid will dissociate hydrogen and bicarbonate, and then hydrogen will cause acidosis in these patients. So if a patient has difficulty to breathe, acidosis, okay? On that, if a patient has diabetes mellitus, for example, then the patient's body will use lipids, because carbohydrates cannot be used to get energy due to lack of insulin or insufficient of insulin. When the body cannot use cocaine, it's when the lipids are used for the energy, then again ketone bodies will be formed. These are acidic substances, acetone, butyric acid, etc. So they will cause acidosis. This time, acidosis is metabolic. We have bicarbonate in the blood. It's a buffer, so it will neutralize the acidic content due to lipid use for energy. So the bicarbonate of the blood will, bicarbonate is or if it's alpha is used to neutralize metabolic acids so that you can decide there is metabolic acidosis in this patient. So in clinics, it is very important. You have to be aware of acidosis or alkalosis, especially children. Again, in children, let's say diarrhea is a very important problem in children. And children can have diarrhea. If there is a diarrhea, what happens to acid-base balance? In terms of acid-base balance, first, the child is losing so much fluid, okay, fluid by diarrhea. So you have to replace the fluid. In addition, its content is rich in bicarbonate because bicarbonate is coming from pancreatic secretion. So when there is a diarrhea, the child is losing bicarbonate actually, losing base actually. When you lose base in your body, acids will overcome, and then in the body acidosis will appear, okay, will show up. On the other hand, if there is a newborn baby, okay, if this newborn baby has pyloric stenosis, you know, at the end of the pyloric section of the stomach, there is a sphincter. This sphincter can be hypertrophied in some children, so gastric content cannot go further to the duodenum, to the small intestine, okay? And these babies, when you feed them, they vomit. They vomit what they eat. In this acidic content of the stomach is lost by vomiting. So acid, hydrochloric acid is lost in this case. What happens to the body of the baby? There will be alkalosis, okay? If somebody is vomiting only gastric content, this person is losing acid, so the body will develop alkalosis. If a person, a child, has diarrhea, then losing bicarbonate-rich gastrointestinal content, so the body will develop acidosis. Okay, there are many applications of acid-base subject in clinics, I mean. So this subject is important, especially in anesthesiology, in surgery, it's very important. But in daily life, it's also important, as I gave you some examples about acid-base regulation. Now let's see what happens, what is written in your textbook. What we are going to learn in these 2 hours, defenses against changes in hydrogen ion concentration. First, we are going to learn about them. Buffers, we have buffers in the blood, in intracellular area, in our kidney. Okay, there are different types of buffers we are going to learn. Lungs are important. I have just said to you, we are losing carbon dioxide when we breathe. When we breathe, we are losing carbon dioxide. Okay, when you lose carbon dioxide, actually you are losing acid. Okay, if you can't breathe properly, then acid will be increased in your body. Kidneys are important. Why kidneys are important in acid-base balance? Although the pH range of our blood is kept very narrow, within very limited range, let's say 7.3 to 7.5, for example, pH 7.3, 7.5, normally 7.4, I can say. Urine pH can vary quite a range, wide range, between pH 5 to pH 8. So this is a wide range. So if there is acidic excess in our body, our kidneys can excrete hydrogen directly or binding hydrogen to ammonium as ammoniac as ammonium ion, or increasing two hydrogen containing phosphates in the urine. So in this way, our kidneys can lose acid, can help regulation of acid-base balance of the body, or vice versa, can also save bicarbonate during acidosis, or in alkalosis it can increase losing bicarbonate in the urine. Okay. Then we are going to learn about buffering the hydrogen ions in the body fluids, in the blood and in the extracellular fluid. The most important buffer is the bicarbonate system. Why is that? We are going to learn. And then respiratory regulation of acid-base balance. If there's acidosis in the body, then the peripheral chemoreceptors will be stimulated, and then they will stimulate respiration. Okay. And renal control of acid balance we are going to learn in much detail. You can see the subtitles here. How our kidneys regulate the acid-base balance of our body in alkalosis or in acidosis or in normal condition, everyday life, and then quantifying the renal tubular acid secretion, of acidosis, and different types of acidosis and alkalosis. We are going to learn metabolic acidosis, metabolic alkalosis, respiratory acidosis, or respiratory alkalosis. When respiration increases, if you stop breathing or less breathing, carbon dioxide will be increased in the blood, so it will cause acidosis. But if you respirate frequently and deeply, this time you will lose carbon dioxide, and when you lose carbon dioxide, you are losing acid, okay, somehow. And then this time alkalosis, respiratory alkalosis can develop, okay. Renal correction of alkalosis, metabolic alkalosis results from increased bicarbonate. Respiratory alkalosis, I have just mentioned to you. These are the headlines. Now we are going to go into detail. Now hydrogen ion concentration in the blood is regulated very well. Hydrogen concentration in the extracellular fluid, blood plasma is a part of the extracellular fluid. As you see, it is very difficult to talk about this number. 2468, how to talk about this, 40 nanoequivalent per liter, etc. Normal variations is about 3 to 5 nanoequivalent, but to talk about it by pH presentation minus logarithm of hydrogen concentration, and then it is very easy. Then you just say pH is 7.4. Okay, this is the arterial blood pH. Venous blood, on the other hand, pH is carbon-rich blood. So the cells produce carbon dioxide, and carbon dioxide-rich blood has a little bit lower pH value. Okay, 7.35. When you measure pH, and if it is lower than 7.4, then you say that there is acidosis. By the way, there is an opposite relationship. When this number goes down, it means hydrogen ion concentration is increasing, so it is acidosis. Below 7.4 is acidosis. Above 7.4 is alkalosis. Okay. Lower limit that a person can survive is 6.8. If it is lower than 6.8, after a few hours the person is going to die. The upper limit is 8. Okay, so the highest 8 and the lowest 6.8, a person can stand for a while and then die. Here you see the values of pH in different parts of circulation and also in urine and also stomach. Arterial blood 7.4, venous blood 7.35, interstitial fluid is similar to the venous blood 7.35. Intracellular fluid pH varies between 6 to 7.4. As you see, it is lower, and urine pH varies between 4.5 to 8, and gastric hydrochloric acid 0.8. So it is very, very acidic, quite acidic. Now, defense against changes in hydrogen ion concentration. Buffers, lungs, and kidneys defend us against changes of hydrogen concentration. Our body has three primary lines of defense against changes in hydrogen ion concentration. First, chemical acid-base buffer systems of the body fluids. They immediately combine with acid or base to prevent excessive changes in hydrogen ion concentration in our blood. Secondly, the respiratory system takes part in the regulation of acid-base balance by removing carbon dioxide, therefore removing carbonic acid from the extracellular fluid. So this mechanism operates within seconds to minutes and acts as a second line of defense against acidosis or alkalosis. And the thirdly, kidneys, which excrete either alkaline or acidic urine, in this way adjusting the extracellular fluid hydrogen ion concentration toward normal during alkalosis or acidosis. This mechanism is slow but very powerful. It needs hours or days to regulate acid-base balance of blood. Now, buffers in the body fluids. A buffer, what is a buffer? You know, cars, there is a tampon or buffer of a car. So when you hit somewhere, it will be broken. You can replace it. It's not so important. It is plastic, made of plastic mostly. So it keeps your car. Like that, a buffer in the body is any substance that can reversibly bind to hydrogen. The general form of buffering reaction is as follows. Buffer binds with either acid or base and then forms a weak acid H buffer. In this example, free hydrogen combines with the buffer to form a weak acid hydrogen buffer. When the hydrogen concentration increases, the reaction is forced to the right side of the reaction and more hydrogen will bind to the buffer for as long as available buffer is present. When the hydrogen concentration decreases, the reaction shifts toward the left and hydrogen is released from the buffer. So this is a buffer system, how buffer system is working. Among the most important buffer systems in our body are proteins in the cells and to a lesser extent proteins in the plasma, albumin for example, and interstitial fluids. Actually very little amount of protein is present in the interstitial fluid. Phosphate buffer system is not a major buffer in the extracellular fluid, but it is an important buffer in intracellular area and also in the renal tubules. Okay, here you see phosphate, monophosphate, and dihydrogen phosphate. Okay, monohydrogen phosphate and dihydrogen phosphate. If there is acidosis, two hydrogen phosphates are increasing, so binding hydrogen and getting two hydrogen phosphate amount will be increased in acidosis. The most important extracellular fluid buffer is bicarbonate buffer system. Primarily because the components of this system, carbon dioxide and bicarbonate, are regulated by lungs and kidneys. That's why, although the pKa, the optimum working pH value is quite low compared with 7.4 of blood, this system is still very important and very functional because the components of this buffering system is regulated by our it is regulated by our kidney. That's why this system is the most important extracellular buffering, extracellular buffer in. Let's see this buffering system more closely. Bicarbonate buffer system consists of a water solution that has two main ingredients: a weak acid, carbonic acid, and a bicarbonate salt, such as sodium bicarbonate. Bicarbonate is formed in the body through the reaction of carbon dioxide and water. So this is a carbonic anhydrase catalyzed reaction. Carbon dioxide reacts with water and form carbonic acid. Carbonic acid ionizes and hydrogen and bicarbonate ions will be formed in the solution. The second component of the system, bicarbonate salt, occurs mainly as sodium bicarbonate in the extracellular fluid, and sodium bicarbonate ionizes and then gives sodium ion and bicarbonate in the solution again. So if we look at the whole system together, we see carbon dioxide is combined with water, reacts with water in the presence of carbonic anhydrase enzyme, and carbonic acid will be formed, and carbonic acid can dissociate into hydrogen, and carbonate and bicarbonate will bind to sodium. Okay. When a strong acid is added to this solution, increased hydrogen concentration will be buffered by bicarbonate. Okay. And carbonic acid will be formed, and then carbonic acid will dissociate to carbon dioxide and water. Carbon dioxide can be removed by respiratory system. Opposite reaction takes place when a strong base such as sodium hydroxide is added to a bicarbonate buffering solution. This time sodium bicarbonate salt will be formed and water. In this case, hydroxyl from sodium hydroxide combines with carbonic acid to form additional bicarbonate. The weak base, sodium bicarbonate, replaces the strong base, sodium hydroxide. At the same time, the concentration of carbonic acid decreases, causing more carbon dioxide to combine with water to replace carbonic acid. Okay. Net result is a tendency for carbon dioxide levels to decrease, but reduced carbon dioxide in blood inhibits respiration, therefore decreases the rate of carbon dioxide expiration. The rise in blood bicarbonate is compensated for by the rise in renal excretion of bicarbonate. There is an equation called Henderson-Hasselbalch equation regarding this bicarbonate buffering system. pH equals to 6.5 plus logarithm bicarbonate divided by 0.03 times carbon dioxide partial pressure. In this equation, carbon dioxide represents the acidic element because it combines with water to form carbonic acid, and bicarbonate represents the basic element. So bicarbonate is expressed as millimoles per liter. On the other hand, carbon dioxide partial pressure is expressed as millimeters of mercury. The greater the carbon dioxide, the lower the pH, and the greater the bicarbonate, the higher the pH, according to this equation. So pH value is just opposite to the acidic or basic content. Okay, 7.4 is neutral, normal value. If it is 7, then as you see, it goes down, the number goes down, but actually hydrogen concentration, actually number goes down and hydrogen concentration goes up. There is a just opposite relationship. So between these two. So pK value of bicarbonate system is close to 6, as you see in this figure. Although the pK value is close to 6, blood pH is 7.4, and this buffering system, bicarbonate buffering system, is working at pH 7.4 very, very nicely, very well. Why? We have just said it is because the components of this buffering system are regulated by respiratory and renal systems of our body. Carbon dioxide is regulated by respiratory system, and bicarbonate is regulated by our kidney. So that's why this system, although it's quite far to the optimum pK value, it works very well in the body. When disturbances of acid-base balance result from primary changes in extracellular bicarbonate, they are referred to as metabolic acid-base disorders. Acidosis caused by a primary decrease in bicarbonate concentration is termed as metabolic acidosis, whereas alkalosis caused by a primary increase in bicarbonate concentration is called metabolic alkalosis. So if blood bicarbonate level is affected, either increase or decrease, this means the event is metabolic. Okay? If blood carbon dioxide is increased or decreased, this time it means it is respiratory. Okay? Acidosis caused by an increase in carbon dioxide partial pressure is called respiratory acidosis, whereas alkalosis caused by a decrease in carbon dioxide partial pressure is called respiratory alkalosis. Now, regulation of acid-base balance by respiratory system. Because the lungs expel carbon dioxide from the body, rapid ventilation by the lungs decreases the concentration of carbon dioxide in blood, which in turn decreases the carbonic acid and hydrogen concentrations in the blood. So it causes respiratory alkalosis in this way. Conversely, a decrease in pulmonary ventilation increases carbon dioxide and hydrogen concentration in the blood. Increased hydrogen ion concentration stimulates pulmonary ventilation. Not only does the pulmonary ventilation rate influence the hydrogen concentration by changing the carbon dioxide partial pressure in our body fluids, increased hydrogen concentration markedly stimulates our pulmonary ventilation. Okay? When pH decreases from normal value of 7.4 to strongly acidic, let's say 7, pulmonary ventilation increases to 4 to 5 times of normal. This in turn reduces the carbon dioxide of blood and returns hydrogen concentration back to normal values. Here in this picture you see the alveolar ventilation and pH relationship. Okay, when alveolar ventilation decreases, then pH will be decreased. So this means carbon dioxide is increasing in the body. When you increase your respiratory rate, your alveolar ventilation 2 times, 2.5 times, then pH will be increased. So it means there will be alkalosis in this case due to carbon dioxide loss by increased respiration. By the way, I can give you an example about this in emergency clinics. Generally, newly married bride, okay, she is married and to a large family boy, and they live together, mother, father, children, and I don't know, uncles, maybe others, in a large family, and she has to work very much. She has to prepare breakfast, she has to prepare lunch, she has to prepare dinner, she has to wash the dishes, she has to clean the house, she has to wash all clothes, etc. And she will get tired after some time. Sisters of her husband, they are not helping her at all. Uh, After some time, she starts to breathe deeply and frequently, so she will faint because of respiratory alkalosis. And then they will bring her to the emergency medicine. Oh, what happens to our girl, our bride? Please, doctor, can you help us? And doctor just give a bag to this lady. She breathes into the bag, okay? So she take carbon dioxide back. She expires and take it back. So after a few minutes, her acid-base balance will be normalized, and an injection, generally vitamin C or isotonic injection, is made to the girl, to the woman, and then they go back home. And then now mother-in-law says that, okay, please don't touch my sister in law, please help her prepare the breakfast, prepare the lunch, prepare the dinner, wash the dishes, etc. So, as you see in clinics, somebody can develop respiratory alkalosis. A bride in a large family can develop. So you should be aware of this clinical condition. When you become a doctor, you can encounter such situations. In this graph, you see the arterial pH change when alveolar ventilation changes, okay? When the alveolar ventilation goes down, pH value goes up. There is a negative correlation between alveolar ventilation and pH. When alveolar ventilation uh, increases, the pH will be decreased, okay? There is a negative correlation here. Let's say hydrogen ion concentration is increased. This will stimulate alveolar ventilation, and increased alveolar ventilation will increase carbon dioxide removal from the body. So blood carbon dioxide concentration will go down. So blood hydrogen concentration will go down because carbonic acid concentration will go down. Conversely, if the pH increases above normal, the respiration becomes depressed and the hydrogen concentration increases toward normal. Respiratory system can return hydrogen concentration and pH to about 2/3 of normal within a few minutes after a sudden disturbance of acid-base balance. Abnormalities of respiration can cause acid-base disturbances. So impaired impaired lung function, such as severe emphysema. So when you smoke for many years, you can develop emphysema. In emphysema, the chest cavity is increased, alveol walls are broken, and large alveoles are formed. So oxygenation is not so good anymore. So this is called emphysema. decreases the ability of the lungs to eliminate carbon dioxide. This causes a build-up, increase of carbon dioxide in the extracellular fluid and the tendency toward respiratory acidosis. The ability to respond to metabolic acidosis is impaired because the compensatory reductions in carbon dioxide partial pressure that would normally occur because of increased ventilation are blunted. Conversely, overventilation causes a reduction in carbon dioxide partial pressure that attends respiratory alkalosis. I have just given you an example of this. Now, renal control of acid-base balance. Kidneys control the acid-base balance by excreting either acidic urine, which reduces the amount of acid in the extracellular fluid, or basic urine, which removes base from the extracellular fluid. Overall mechanism by which kidneys excrete acidic or basic urine is as follows. A large quantity of bicarbonate is filtered continuously into the tubules. If bicarbonate is excreted into the urine, base is removed from the blood, it means. So a large quantity of hydrogen is also secreted into the tubular lumen, thus removing acid from the blood. If more hydrogen is secreted than bicarbonate is filtered, so there is net loss of acid from the extracellular fluid, it means. Conversely, if bicarbonate is filtered, then hydrogen is secreted, so there is a net loss of base. In addition to secretion of hydrogen and reabsorption of filtered bicarbonate, the kidneys can generate new bicarbonate from reactions that take place in the renal tubule. Kidneys regulate extracellular fluid hydrogen concentration through three basic mechanisms. First, by secreting hydrogen. Second, by reabsorbing filtered bicarbonate. Third, by producing new bicarbonate. First, secretion and reabsorption of bicarbonate ions by the renal tubules. Hydrogen ion secretion and bicarbonate reabsorption occur in virtually all parts of the tubules except descending and ascending limbs of the loop of Henle. Bicarbonate is not reabsorbed directly by the tubules. Instead, it is reabsorbed as a result of reaction secreted hydrogen ions which filtered bicarbonate ions in the tubular fluid under the influence of carbonic anhydrase in the tubular epithelium. You will understand this when you see the pictures, okay? For each bicarbonate reabsorbed, there must be a hydrogen secreted. Okay, hydrogen is secreted into the tubular fluid by sodium-hydrogen countertransport in the proximal tubule, the thick ascending segment of the loop of Henle, and the distal tubule. So, here you see the figure. This is the tubular cell, okay, thick segment of Henle or distal tubule, and this is tubular lumen, and this is renal interstitial fluid. As you see here, carbon dioxide and water are combined and forming carbonic acid, and then it will dissociate into hydrogen and bicarbonate. Bicarbonate will be absorbed and hydrogen will be secreted into the tubular lumen. Okay, so what happened in this case? We lost hydrogen and then we lost acid and we got base, bicarbonate. So cellular mechanisms for active secretion of hydrogen into the renal tubule, and second, tubular reabsorption by combination of hydrogen to form carbonic acid, which dissociates to form carbon dioxide and water, and sodium ion reabsorption in exchange for hydrogen secreted. This pattern of hydrogen secretion occurs in the proximal tubule, thick ascending loop of Henle, and early part of the distal tubule. So the secreted hydrogen is consumed by the reaction with bicarbonate, forming carbonic acid, which dissociates into carbon dioxide and water. Carbon dioxide diffuses into the cell and is used to form carbonic acid and eventually carbonic acid will form bicarbonate, which is reabsorbed across basolateral membranes of the tubules, as you see here. Normally, more than 99% of the filtered bicarbonate is reabsorbed by the renal tubules, with about 95% of the reabsorption occurring in the proximal tubules, loops of Henle, and early distal tubules. Here you see the amount of filtered bicarbonate, and 85% of it, 3,672 milliequivalent, is absorbed from the proximal tubule, and 10%, 432 milliequivalent, is absorbed in the thick segment of Henle, and then 4.9% is absorbed in the distal tubules or collecting ducts. In late and collecting tubules, hydrogen is secreted by primary active transport. So the same mechanism is used for bicarbonate reabsorption in late distal and collecting tubule as used in other tubular segments, although the total amount of hydrogen secreted in the late distal tubules and collecting ducts is not so much. These segments are capable of increasing hydrogen concentration as much as 900-fold, which reduces the pH of the tubular fluid to about 4.5. So not lower than this, because otherwise it will burn the urethra, okay? Vesica urinaria epithelium. You see here hydrogen secretion. This is the tubular cell. Again, carbon dioxide and water are combined in the presence of carbonic anhydrase. They form carbonic acid, and it will dissociate into hydrogen and bicarbonate. When bicarbonate is absorbed, hydrogen is secreted by a hydrogen ATPase pump, and chloride will diffuse out. So hydrochloric acid will be secreted, making ultrafiltrate quite much acidic. So the lowest value is 4.5, pH 4.5. Lower than that can burn the tissues, okay? Bicarbonate is titrated against hydrogen ions in the tubules. Under normal conditions, the rate of tubular hydrogen secretion is about 4,400 milliequivalent per day, and the rate of filtration of bicarbonate is about 4,320 milliequivalent per day. The quantities of these two ions entering the tubules are almost equal, and they combine with each other to form carbon dioxide and water. Carbonic acid, bicarbonate and hydrogen normally titrate each other in the tubules. Titration process is not exact because there is usually a slight excess of hydrogen in the tubules to be secreted. Excess hydrogen, generally 80 milliequivalent per day, get rid of the body of non-volatile acids produced by the metabolism. Non-volatile acids cannot be excreted by respiration, okay? We cannot convert them to carbon dioxide, so we have to get rid of them by urine, by our kidneys. Most of the hydrogen is not excreted as free hydrogen ions, but rather in combination with other urinary buffers, especially phosphate and ammonia. Let's say pH now it is 4.5, and we have still excess hydrogen in the body. Our kidneys can get rid of this excess hydrogen not by directly excreting it freely in the urine, but combining it with 2 hydrogen containing phosphate, or combining it with ammonia, NH3 ammonium ion, and forming ammonium ion NH4 in the form of ammonium. It is excreted from the body. With alkalosis, urine has excess bicarbonate compared with hydrogen, because bicarbonate cannot be reabsorbed unless it reacts with hydrogen. So excess bicarbonate is left in the urine and is eventually excreted, which helps correct the alkalosis. In just opposite situation, in acidosis, urine has excess hydrogen compared with bicarbonate. So excess hydrogen in the tubular fluid causes complete reabsorption of the filtered bicarbonate, and the excess hydrogen passes into the urine after combining with buffers in the tubules such as phosphate and ammonia. Thus, the basic mechanism by which the kidneys correct acidosis or alkalosis is incomplete titration of hydrogen against bicarbonate, leaving one to pass into the urine and therefore to be removed from the extracellular fluid. We can give here for 10 minutes break. If you have any questions, you can ask. If you have any questions for the subject until now, we have covered until now, you can ask. Do you have any questions or contributions also? All right. Then I will stop recording here, and then after 10 minutes we will continue. Okay?